Good morning, everyone. Welcome. My name is Sarah Anstein. I am the Director of Partnership and Outreach here at the One Ohio Recovery Foundation. On behalf of our team, I want to thank you for joining us today for this important discussion on grant implementation readiness. We are thrilled to have such a strong turnout for today's Impact Academy. Before we dive in, I want to cover just a couple of housekeeping details. First, this webinar is being recorded. So if you want to go back later and rewatch it, or if you want to share it with a colleague, this is being recorded. We will post it on the Foundation's website, including the slides and links to any resources. So if you have to jump in and out or have a colleague that missed it, don't worry. This is recorded and will be posted on our website here very soon. We also encourage your engagement throughout today's webinar. So if you have questions at any time, please throw it in the Q&A. We will be monitoring them throughout the session and have a dedicated portion at the end where we will get to as many of your questions as we can. So I want to just introduce the foundation in case there's anyone here that is new to following our work or is new to maybe thinking about applying for a grant with us. The One Ohio Recovery Foundation is a nonprofit charitable foundation, and we were created to distribute 55% of the funds that Ohio receives from the pharmaceutical industry as a result of the opioid epidemic. So that is who the foundation is. And we have a really big mission, and all of our grantees, our regions, our stakeholders and interested applicants, you are all part of our mission in helping us see this come to reality. And we have a really big purpose. It's a threefold purpose. We promote the health and safety of Ohioans, we advocate for the interests of Ohioans, and then we also fund. So today we're here talking about some of the things related to our funding work. So we're so excited that you are all here. And so what great timing. We have announced details for our next regional grant cycle. So what better time to be talking about grant implementation readiness than now? So the timeline for this next grant round, in December, we will be releasing the RFP. So in December, the request for proposal will go live. We will do lots of mass communication about that. We will have a webinar about the RFP, and it will be posted on our website. So stay tuned for December when that RFP goes live. Then in January, our grant portal will open, and you'll have the opportunity to submit a funding inquiry. So the grant portal is not live yet. You haven't missed anything. You don't need to register. More details are forthcoming about the grant portal and the funding inquiry. And then February, the review of all of the funding inquiries will begin. So this is all right around the corner from us. And again, what a great time to be talking about grant implementation readiness as we get ready for the next grant round. If you haven't visited our website in a little bit, please do so. If you hover over the Grants tab, and then click Grant Process, you will be taken to our updated grant headquarters page. This is where everything that we have for the next grant round will be posted, including that RFP and many more resources and documents to come to help you submit the strongest application that you can. So knowing the timeline and where to access the soon-to-be-released RFP is just one part of being ready for this next grant round. The real key is understanding how to prepare your organization for successful implementation. And that's where our featured speaker comes in today. We are joined this morning by Rick Krasinski from the Center for Evidence-Based Practices at Case Western Reserve University to give us an overview of their work and their implementation readiness checklist that they developed. So Rick, thank you for joining us today, and I'll now turn it over to you to get us started.
Thank you, Sarah, and good morning to everybody, and thanks for taking time out to join us today. I imagine there are a lot of friends of ours and colleagues out there, and I'm glad you could be here. So Just a bit of context. Sarah and I had been talking on and off over the last couple of years, really. And each time the subject of implementation and grant implementation came up, there was just a lot of synchrony between the foundation's experiences and what we as a technical assistance center encounter when we're working very directly with organizations to implement evidence-based practice models. I'll let you slide us forward here and keep going. Just a bit of context. We are attached to the School of Social Work and the Begun Center therein at Case Western Reserve University. The Center for Evidence-Based Practices has been around for about 25 years. Over the last 2 or 3 years, many of you have gotten to know us through the series of free trainings on a variety of evidence-based and evidence-informed practices that we've been offering to Ohio practitioners. As I mentioned, we're a technical assistance center that provides training, consultation, and program evaluation, largely in the form of fidelity to best practice models that we have among our product lines. Next. More propaganda about us you can read and check out our little website there. By all means, feel welcome to come out and take a look at our materials. I would offer that one of the cool byproducts of the last couple of years of the SED COE project has allowed us to develop a number of really user-friendly materials that are all hosted as free downloads and can be requested as physical copies for those who want, and encourage you to muck around on the website and see some of the stuff that's there and see what might be useful to you. Next. I mentioned we do work across a number of product lines. And we began with IDDT back in 2000 or so, and have branched into a number of other areas with very particular models that we are somewhat specialized and expert in, and have found ourselves kind of branching out continually over 25 years. So let me start the context for all of this. When our center started 25 years ago, we were tasked by the state to participate on behalf of the Department of Mental Health and Department of Addiction Services, because we were not yet integrated that way, as a collaborator with SAMHSA on their National Implementing Evidence-Based Practices project, the single largest study of its kind in community behavioral health in the United States. So we focused on dissemination of and evaluation of integrated dual disorder treatment as our part of that project. And as anyone responsibly would do in a project that was identified as implementation oriented, was to start looking at the literature on what could be claimed reliably about what works in implementation and what doesn't. And an absolute cornerstone of our learning early on began with Dean Fixon and his colleagues from the University of South Florida, who wrote up a tremendous monograph that summarized the best of the implementation research. And you'd say, well, that's 20 years ago now, Rick. I'm sure that that's evolved. And the reality is that with all of the work that's gone on since, this still holds up really, really strongly. And while a lot of newer research hits on nuance and enhancements, the core principles and the core concepts are still very much what they were 20 years ago. Next. What was compelling to us as part of that SAMHSA project I talked about is that they said, look, we already know that there's practice models that have good evidence. What we don't know is what's keeping people from doing that, from putting those into play. There was a study known as the Port Schizophrenia Study that came out in the early to mid 2000s, and it spoke to how many known practice models of treatment that was effective with that population were not found to be in use in community agencies. And so SAMHSA set out to say, well, let's figure out what the barriers are and why people aren't getting known effective services into routine service delivery. And when we looked at Fixon's literature and others, of 1,054 studies on evidence-based practices, only 22 of those dealt with implementation variables. And it's pretty compelling to us because when we're working with an agency, it doesn't take long to teach people what a model entails or what skills or knowledge are necessary to enact it. But the time and energy spent implementing those models is considerable. We'll talk about some variables here today in that regard. Next. Sort of to summarize right out of the Fixon content and something we find ourselves very much espousing to this day. The challenges and complexities of implementation are generally more complicated than the model themselves, than the treatment approach itself, than the prevention approach itself, than the collaboration itself. All of those things, really, the implementation underscores how important that is. We have, over the last 25 years, been engaged with all of the learning sources that you see listed here, pulling our own lessons learned about implementation dynamics from across these stakeholders. And everything we talk about today and that implementation readiness is drawn from input across all of these. Next. What emerged in our own lessons learned with those stakeholders and collaborators around the country and around the world really were distinct themes that you could attach and predict successful implementation efforts based on the presence or absence of different implementation variables. So much so that our center, and let me just put this in context, we probably receive 2-3 requests a week for us to come train somewhere. And we find ourselves having to say, well, we can do that, but we should explore whether or not training is what you need or want. Training doesn't change practice behavior. Training doesn't install treatment program models or frameworks. Training can move people from not knowing about a thing to knowing about it, but there's a whole lot else other than training that goes into installation. So we started a good 15, 20 years ago, engaging every prospective customer with some questions up front to help us understand if they were tilling the soil for success, if you will, and that we could help them prep in a way that maybe they thought that what they needed was training, but what we identified were some other things for them to tackle first. As an example of this, I referenced that we were doing a lot of work with integrated dual disorder treatment back in the early 2000s. We put together an implementation guidebook for that in which we had identified that there's basically 35 steps, if you will, in installing IDDT. What was compelling is that training was step 28 of 35 things that needed to be done. And yet, when we were contacted by organizations, nobody asked us for the first 28 things. They all said, can you come and do training? To which we were always, well, sure, we could do training, but if you think that training alone is going to get you where you're going, it's not. There are a whole lot of other variables that we can be useful to you addressing. Next. So hence this discussion started with Sarah, and we agreed that we would dabble in talking with you all about this and go back and forth between us about what we've seen and what the foundation has experienced that often mirrors or parallels what we've learned about implementation readiness more broadly. So we'll ask the audience permission for Sarah and I to be a bit interchangeable at times throughout the coming slides, where I'll talk about some of the conceptual stuff, but Sarah's got some really great context as it relates to Ohio and grant implementation as well. So we'll be playing off of each other, and this is our first time presenting together. So we beg your patience as we riff on a few things.
That's right.
Next.
And I did want to thank you, Rick, for really setting the kind of stage for us about, that this is implementation science. And I love that that's the work that y'all do, because that's also what we do from our evaluation standpoint.
Yes.
We look at it from an implementation standpoint. What was your plan? And then what was reality? And what are things we maybe could start to anticipate on the front end to make things go maybe a little more according to our plan. And I was happy to see a question came in the chat or in the Q&A about a link to Fixen's work. So I didn't want to, I'll have to look that up and get with Rick after, but if that's available, we'll definitely post that as well.
For sure. I can send you that document. It's in the public domain. We can make it easily
That's
available.
what I was hoping. Great. Yeah. So love that others on the line were wanting to dive into some of that work. So that's really great to see.
Indeed.
Okay. So now we're going to dive in to the checklist. Back to you, Rick.
Yeah. So we put together this checklist with variables that were pulled directly from not just the literature, but from real world implementation experience. Important to note that the staff of the CEBP, while we're housed at Case Western Reserve University, our group identity, if you will, is in direct practice. All of us are former program directors, program managers, clinical supervisors, and have installed the models that we provide TA for. And so bring a bit of real world perspective to everything that we do in that regard. You'll see summarily that there are a number of considerations that inform our readiness checklist listed out there on your left. I'm going to talk about each one of these with a little bit of detail. Sarah will chime in when she wants, and let's keep it going.
And I did make us a fancy QR code, Rick.
If only there were a QR code where people could easily access the implementation readiness checklist. Please feel welcome to check out the document. And as well, there's an opportunity there on the website if you want physical copies of it for your team or anything like that. We have plenty printed and are more than happy to send those out to you at our cost. So no worries there.
Great. And if for some reason you're driving or you're listening to this on your phone and can't take a picture to get the QR code, we will link to this document on our website as well when we post the webinar recording. So lots of opportunities to get it. And I kind of wanted to tee this one up because I'm thinking about our grantees, right? We've announced our next funding round. Folks are already starting to think about what they may want to apply for and, wanted to put out some practical tips for how to use this checklist internally at your organization to make sure that you're really ready for this next grant and whatever you propose. So, one way is to use it as a self-assessment. Review each section. There's like 8, kind of 8 domains, if you will. Reflect on it honestly to see where you are in terms of your current readiness to implement this new program, curriculum, practice, whatever it may be. It's not a test, you don't have to submit a score, you're not being graded. It's really just to reflect, like, where are we in terms of, the likelihood of this being successful? Because I know for me, I can be an ideas girl and I have a lot of things that I want to do and a lot of ideas, but sometimes I forget that I got to bring everyone else on board with me for my ideas to be sustainable and to be effective, which I guess leads to the next point. Do this as a team. And I'm going to be a broken record with this throughout today's webinar. One of the things that we have learned from this, first round and working with our grantees and all of the applicants is that from the beginning, you need to involve all of your internal and external partners that are going to be involved in this. So whoever does, your bookkeeping, your finance, they need to be a part of this, because tracking expenses, knowing how you're going to do the accounting for this grant is important. They need to be on board. Whoever your grant writer is, they need to be on board so that they write a grant for something that actually you can implement and that fits within your organization's priorities. If you have a special person that does data collection for your organization, include them in this conversation as well, because there is reporting for many of the grants, including One Ohio's. And then your leadership, making sure that they all know about this and are supportive. That will ensure that it not only gets implemented successfully, but is more likely to be sustainable. And same goes for any external partners you may be planning to involve in this work. You want everyone to be around the table looking at this checklist to determine, is this the right time? And is this the right thing to do? And then identify areas you may want to strengthen before you apply for funding. You have a little bit of time now to kind of reflect and dig in and maybe pinpoint where you may want to strengthen areas, whether it's staffing, leadership support, data systems. Pursue, getting those ready before you go for another grant. Create that action plan so that we can strengthen those areas and set ourselves up for success. And then lastly, this is, an evolutionary process. So reflect back regularly as a team. Maybe there's new areas where you're really strong or new ones that pop up where we need some work. But use this frequently to kind of take an inventory of where we are. So hopefully that's helpful, of how to take this tool and make it actionable as a team to gear up for whether it's our next grant round or any other grant you may be applying for. Rick, anything you want to add to that?
Yeah, Sarah, I was really glad to hear you mention the grant writer piece. One of the experiences of our center over the last, really, as CCBHCs have come on strong nationally over the last 5 or 6 years, and a lot of federal funding had been made available for that. It was almost a guarantee that we would get brought in to provide technical assistance for one of the elements of a CCBHC, like ACT, assertive community treatment, or like IDDT, or motivational interviewing, some element of it, in which the organization, when we sat down with them to say, okay, here's what implementation is going to involve, looked at us like we were from Mars, because they didn't know the depth and the detail that were involved in what was proposed. And you could feel the disconnect between what the grant writer wrote in order to complete a successful presentation of ideas versus what the leadership group were aware of what that entailed. Let's take IDDT, for example. It's 26 clinical elements of programming that have to be incorporated to a measure of fidelity. And we would go in and start talking about that. And, the teams would say, well, we didn't know it was all that. Well, it reflected grant writers who were doing a nice job of getting proposals developed, but where there was significant disconnect between proposal writers and those who were actually going to be tasked with doing the thing that was being proposed.
That's right. Yeah, I've heard that across the board in a number of places. That's a really good point, and why it matters to have that team approach at the beginning, so we all know what we're getting into, so we can be set up for success and request the amount of money necessary to do those 22 clinical components. This all goes together.
The same pageness is where it's at.
Yeah, that's right. I love it.
Next. So let's talk about these 8 areas that Sarah alluded to. The very first question that we ask any organization is, why now? Why haven't we been doing this up to this point? Or what are we experiencing that requires this intervention or this framework, whatever it is that we're proposing? What's to be gained from installing this now? And does it solve a very specific problem, challenge, or unmet need? There are folks you might not be surprised to know who submit for every grant opportunity that there is because they're chasing the dollars. And I guess I get that. I mean, I've been in nonprofit for 40 years. I get it. But really, if there is a lack of cohesive vision about what problem gets solved by us installing this new thing that we want to do, it makes it very hard to measure impact. And like you have some tremendous colleagues from Mighty Crow involved that do your evaluation, and I'm sure could speak to this as well from their experience. If an organization isn't starting with the end in mind and what it is that's going to be a measurable impact or a measurable difference maker, then it sometimes can amount to just chasing the grant. And let's do as much good as we can. Well, we gotta be better than that, and really identify with some structure and some planfulness what will actually be different, and what kinds of. To your point before, Sarah, it helps predict how much funding to ask for because to know how much energy and resources it's going to be required to implement a thing. And some of those models that I had referenced earlier are expensive to implement.
Yeah.
Now, not every model is, and not every framework is, but if somebody is going after something that ambitious, it really begs for due diligence in terms of how much energy and time commitment is going to be necessary to achieve the outcomes that are desired. So, why now is our first question. Organizational priorities is the next thing that we ask about. And again, as a former program director myself, I get that we're all out there juggling torches and chainsaws and trying to keep everything in the air. But we have observed that there are times when an organization has too much on its plate to be undertaking something new, no matter how interesting or attractive the something new would be.
Yeah.
And what you end up with are agencies, programs, what have you, that because they've taken on too much, their end product across the board is mediocre, or sometimes less than mediocre, as opposed to really excelling at a thing that they might otherwise excel at if they had a bit more time and available to them to focus on one project or a couple of projects. The example I'll give you here are places that, let's take, most of you or many of you have probably encountered at some point the implementation of a new electronic record, electronic health record, or electronic programming, or invoicing, whatever it may be. Everybody grossly underestimates how much time and energy that installation is going to take. And so when an organization says to us, we'd like to start this new model with 28 elements to it, whatever, and by the way, we're installing a new EMR next month, it's incumbent on us to say, we might want to think about staggering your startup for the model implementation until you get the more concrete EMR stuff ironed out. Or do you have distinct project leads so that you're not asking one clinical program manager, say, to oversee the EMR implementation at the same time they're overseeing a new clinical practice installation, or prevention model, or whatever it may be. I use clinical because that's the circles we run in, but anything that's being installed, is it getting the right amount of effort and energy necessary to install it well? I can't tell you the number of examples we've seen of organizations and individuals within those organizations who we know to be exceptional at what they do, but who make themselves really average when they take on too many things at once. And it happens too often for us not to talk about. And we sort of pose this question to leadership groups all the time. What are your other priorities right now? And do you have the bandwidth to take on something new the way that you're conceptualizing here. Sarah, any other thoughts from your end on that?
I do have lots of thoughts. And what's hard about this is I know that they relate to the other domains that we're going to cover, so when I think about this one, it triggers for me then sustainability. If I wrote a grant and it was kind of my pet project and it was not an organization's priorities, it's probably not going to be sustained. And so, I need to keep that in mind, right? And why getting leadership support on the front end is so important so that we don't see this great work get started and then not be able to continue because grant funding ended. So much of it kind of triggers other points. So
Yes.
I love that we're talking about them all together as a
Yeah,
group.
it's a good point because there are going to be other elements of this. Everything's connected to everything.
Yeah, but it's
Good
great.
stuff.
And I've got lots to say here, but I'll let you get started.
It is always awkward for us as an outsider with an organization to say, so tell us about your organization's fiscal health and stability, because nobody wants to talk about it when things are perilous. But there's a reason why we ask, and maybe that's the angle to help you understand why we ask. If the installation of a new program is going to require considerable training commitment, let's say, or considerable planning commitment, then staff resources have to be allocated to that. We worked with an agency once that said, we want to install this treatment model and we'd like you to come in and do training for it. And the core training package for the model that they were looking for involved about 40 hours of training spread out over a number of months, but 40 hours of training is a lot of training. And the agency came back after we said, this is what we propose. And well, we can't make our staff available for that. They all are having to meet their productivity, and we're so close to the margin that if we lose 40 productivity hours per staff person, we're going to be in a world of financial hurt. And our thought was, and our reaction was, like, if you're that close to your margin where offering staff training cuts into your ability to pay your bills, then maybe you're not ready to install a model that requires that much staff training. There's no harm or foul in the given fiscal climate to say it's a great idea, we're totally bought in, but now's not the best time. We need to make sure that we've got our sea legs underneath us. But a really important question for us is up front, can you cover the cost of implementation? Are there long-term sustainable mechanisms to continue to pay for what it is that you're building? Are you able to afford the cost of implementation and installation up front? So we poke and prod around that without wanting to know all the details. I don't, ever want to know anybody's books or anything like that. But we do ask organizations to speak to their fiscal health and stability, because we've seen too many places that just once we got involved in implementation and we learned that they were really challenged financially, that it really hampered our ability to offer TA that they deemed was outside of their ability to commit to. So, Sarah, your thoughts on this one?
Yeah. And well, I don't know if you want to hit on anything on this slide.
Oh, yeah.
Yeah.
Well, I kind of touched on those, but
Okay.
the productivity one, the first bullet that you see there, is kind of a theme where our staff are committed to other things that need to generate revenue. And so our ability to make them available to do other things like their own learning is limited. Um, and likewise, there are models out there. I'll use the two that I referenced earlier, assertive community treatment and integrated dual disorder treatment, where those approaches require full-time staff members, including medical professionals. And you start adding up a multidisciplinary team's cost that includes a physician, multiple nurses, program supervisor, and other clinical staff. you're getting pretty expensive. And those upfront startup costs that an organization has to bear as they get going can really challenge implementation viability for them.
That's right. Yeah. And, um, what's great about the One Ohio Recovery Foundation is that we fund in a number of abatement strategy areas. So everything from prevention, treatment, recovery, criminal, legal, harm reduction, you name it. And so, as we're thinking about this, I know in the settings of care where there is reimbursement, some of this is very clear. Some of the trade-offs if staff aren't seeing patients where they can be billing, it's taking time away. So for those of you that don't work in a clinical treatment setting, think about this too from the lens of, sustainability of this project going forward. Or, you're doing a capital project, you want to open up a new recovery house, or you want to buy a vehicle to transport folks to and from treatment and recovery supports. What's the ongoing maintenance associated with that? What's the plan for a hidden cost in the renovation that never goes according to time or budget? Really thinking about that. And as we shift, staff to different things, kind of what are the trade-offs, that we want to look at? Which, some of this leads me to kind of what we have seen so far with the applicants and our grantees. I think we're seeing organizations really demonstrate flexibility and creativity as they navigate kind of an evolving funding and policy environment. We're seeing a number of folks that have had success leveraging the One Ohio dollars for other funding. And we love to see that, where they're able to show, hey, this investment from One Ohio, by us tracking the outcomes, tracking the success stories, we were able to turn around and get more funding for this project. So folks are getting creative. What we've seen through our evaluation is that these grants have helped them increase their partnerships and organizational capacity that will result in them ultimately being able to have more sustainable projects. So we love to see that. And I do want to call out partial funding awards. Lots of folks do get full funding, but not everyone does. And I think for people to be really realistic and honest with themselves, if awarded less money than I initially requested, can I still implement this project, program, curriculum to the degree that I know it needs to be to get the outcomes that we know it can? So really think about that. Or if, you were wanting to implement a quick response team and you asked for funding for the staff person in the vehicle, but you only got, funding for the staff person. Well, where's the vehicle going to come from? And I know a lot of folks, still say, yes, I can do it. I'll figure it out. But, really thinking, can we? Because we want everyone to be set up for success and have really great, experiences and outcomes and stories. And so starting to think about that too, as you're getting ready for what you may request. What if you get partial funding? What's the game plan there? What are other funds you could leverage, or how you may pivot, and being honest about that and the potential impacts. And one of the things that the foundation did earlier in the year was we held an Impact Academy on sustainability. So we got another QR code for you, which will take you to a free assessment. It's the Program Sustainability Assessment Tool. And they also have a clinical version if you are on the line and you provide clinical treatment services. But it is completely free, and you assess your organization in these 8 domains. And if you notice, funding stability is only one of them. Because what we noticed is that, we ask applicants, what's the plan for sustainability of this? And a lot of folks said, I'm gonna apply for more grants. And, to some extent, we get that that's the game. I've been in, nonprofits, I get that, but there's all these other elements that go into sustainability as well that we can, in some ways we have a little more control over, right? Like our communications and marketing, that is something like we can control and we can immediately change. our partnerships in the community. So I would really encourage everyone, watch that webinar. I'll talk about it at the end. Take this assessment, see where you're at. Because we want to make sure that all of the great work that y'all are doing, whether it's with the One Ohio grant or other funds that you have, are sustained and that our organizations are strong and can continue on. And then the last thing that I'll add, kind of what we've seen from, this first grant round is back office financial support is key. And I know if you're a small nonprofit, you're wearing a lot of hats. So this may also be your executive director or, the office manager, but your fiscal staff, whoever is going to be tracking the budget expenses, they need to be involved with the grant from the beginning. Really from reading the RFP to determine if this is a good fit. And this needs to, include, making sure that the budget that you submit includes the true costs. So really, think through what all is this really going to take to implement it to fidelity, to get the results and the outcomes that we want to see so that we don't have to do a lot of changes in budget amendments. Have a plan for the fiscal reporting and understand it. What's going to be expected of you? Know how you're going to be tracking those expenses, because we do ask you to report that. And then do you have internal alignment with grant management accounting? Because it is different from other types of accounting. So again, just kind of checking in with whoever on your team from the fiscal side is going to be helping with the budget and the tracking of expenses, and then that fiscal reporting is involved and knows what this is, and making sure that what you currently do organizationally is then going to match what you're going to need to do for this grant. So this was a key point from our grant evaluation team. They wanted to make sure I stressed, because we're seeing that, there's just been a lot of questions about this. So Rick, anything to add from your experience?
Yeah, if you could go back a second, Sarah, to the slide on sustainability. Yeah, it was validating to see strategic planning listed in the middle of it all. And I'm reminded that there are funders and foundations and health authorities who have been known to award planning grants that are much, much smaller than the overall amount necessary to install or implement a program, but wherein the funder had said, look, we'll give you 50,000 to show us a detailed plan, and we'll give you some time to do your research and to really build out the plan. But we're not just going to go in and dump, hundreds of thousands or millions of dollars when we haven't seen a plan that feels that can be actuated. And so that's sort of the notion that time is spent accounting for planning, including, to your point, Sarah, that if an organization isn't awarded a full amount, that perhaps what they could be doing is way more detailed planning, sort of turn it into a phase 1, phase 2 kind of thing. But anyway, just thought as I was listening to you.
I like that. I like that thought. What about supervision?
Oh, supervision. I am telling you, friends, that if there is one variable that will absolutely make or break an implementation, it is the buy-in to supervision, the availability of supervision, the right supervisor. The questions that you see posed here, do you have the level and quality of supervision necessary to ensure adequate oversight? It leads into that second bullet where I'll ask an organization, basically we have a mantra around our shop, as the supervision goes, so goes the initiative. If you asked me to show you the 10 best implemented evidence-based practice models in the country, I would also be showing you the 10 best supervisors we know. And if you asked me to show you the 10 most problematic or most challenging, many of those, if not most of them, also tie back to the nature and the quality of the supervision that was available. which I don't, by the way, always put on the individual supervisor. In fact, what's more likely to account for problems with supervision are supervisors who are given 7 things to do as part of their job and who are then not able to do any one of them with great success. And I ask this question of organizational leadership in the readiness process all the time. If I got your supervisor in this meeting right now and asked them if they had a doable job, what would they tell me? What would they tell me if you weren't in the room and I asked them, tell me about the doability of your job, the way that it's presented to you? And we all understand. I don't think there's anybody on the meeting today that doesn't understand that there's stuff that's above and beyond we're always going to be needing to do in our jobs. But if the above and beyond is built into the routine, and a supervisor says to us, I barely have time to actually meet with the staff to develop their knowledge and skills because of all the meetings and reports that I have to do otherwise, then you have to ask yourself what the implications for quality installation of that practice framework is going to be when you know that they're pretty much telling you our staff need to develop their knowledge, they need to develop their skills. Some may even need to develop their attitudes and beliefs about something. That needs supervisory time, it needs coaching availability, it needs formal instruction. If our supervisor is overcommitted to other projects or to other responsibilities that senior management has put on them, it compromises their ability to impact the staff who are going to carry out the initiative.
That's right. Both, and I also think of this in terms of the ability to ensure whatever it is being implemented to fidelity to ensure it remains evidence-based. So if I don't have that good supervision, it may be causing harm unintentionally because I don't have that supervision. And I know a big area is around the supervision of peer supporters, certified peer supporters. And a lot of organizations were seeking funding to hire peer support. And so making sure that we really understand the supervision that goes in there so that, again, we set everybody up for success and really support that kind of nascent peer workforce. So I know that's one area that we've talked a lot about within our expert panel is around supervision of certified peers and how best to do that.
So I want to make one other point on that last bullet. I referenced earlier the Sampson National Implementing EVPs project. And as part of that project, we collaborated with other TA centers around the country. And we had colleagues from the University of Kansas School of Social Welfare who basically said their lesson learned coming out of the first 2 years of the project was that they weren't going to train or work with direct service staff at all in the first 2 years of the project. They wanted to get the supervisors and program managers comfortable such that those people became the consultants, became the trainers, rather than throwing a supervisor into a training session where they know nothing more about the model than the people they're being trained with, but now are somehow the next day expected to be expert in it or expected to be able to develop people's professional skills and knowledge when they themselves are having to develop their skills and knowledge. And so it's not a problem to have a supervisor that is less familiar with a model. But if we recognize they're going to need their own development to be proficient at this, then what are we doing to make sure that they have access to that rather than putting them in a position to supervise a framework that they can't supervise, or at least yet? Let's talk about buy-in. The number of times we have gone into an organization where senior management has said, we really want this. We want to do this thing. We want to build this program. And then we find out that somewhere, somebody in the food chain at the organization isn't quite as sold on the doability of that or the need for that. The message here is this: it's not enough for your CEO to say, here's the vision, we're going to do this. Way too many times we've seen, well, the CEO wants it and the COO wants it and the program director wants it, but the medical director doesn't believe in it. Or any person anywhere in an organizational food chain who has decision making authority, who is not bought in, has the potential to derail the initiative via their lack of buy in. So, to Sarah's points in the very earliest part of the presentation, the getting everybody on the same page and following up to make sure everybody is staying on the same page is absolutely a critical implementation variable. That if we haven't achieved organizational leadership consensus and everyone understands what we're doing and why we're doing it and how we're doing it, it only takes one person to say, I'm not feeling that, to wreck the whole thing. So this becomes, for as late as it's listed here, among the variables for implementation readiness, off the top, you have to have this, or build towards it at least. I mean, I don't begrudge anyone the opportunity to say, well, I'm not so sure about that yet, or we're not necessarily built for that. Fine, let it spur on the conversations and the planning and the discussion, and maybe even the internal debate about what's going to work or what's not. Maybe it spurs on some research internally and doing our homework. Maybe it makes us want to go check out a program that's already doing it and ask their leadership, if you had this to do again, what would you do differently? Or what would you recommend to somebody who's thinking about it, or dabbling in the idea of doing it? Whatever it may be, when you don't have synchrony amongst decision makers at any point in that organizational system, it has the potential to derail the whole initiative. Sarah, anything you want to say on that from the foundation's experiences or anything that way?
Yeah. Couple points here. I would say if you're planning to, for example, deliver services in the jail or in schools, make sure that those stakeholders are aware that they're being included in your grant and that they're on board. Anyone that, if you're taking services outside or you're planning to, if you need very specific referrals for something, be having those conversations now so that when the grant starts, you can hit the ground running and didn't kind of commit people without them being fully bought in. And then I would say all the stuff we've been talking about applies there too. That whole leadership of, whatever partner organization it is, that they're all on board so that there's no challenges when you go to deliver those services there. That's one big thing I think is really key, just making sure all the partner stakeholder groups that the success of your project is contingent upon are aware of this grant and supportive, and that y'all have thought about a plan for how you're going to partner and work together. And, do you then have any of the necessary approvals and sign-offs for the grants? If you have to go, if you're a local government, if you're a local county agency and you need to get, something from the auditor's office, or if the funds route somewhere different, like making sure that all those T's are crossed, I's are dotted. So again, there's no delays and there's all of that buy-in from the necessary, I would almost call them like operational stakeholders. If you have a fiscal agent or a part of a larger entity, that all of that is good to go on the front end.
Can you go back a second? Because there's one other point about that, Sarah, that I want to make sure we hit. And I thought you do a really nice job of talking about that, the second concentric circle of buy-in, which is our external, right? What I was talking about was we start with our internal buy-in. But the number of times where we have seen, I'm give you an example, organizations who want to install a motivational stages of change approach to their treatment modality, but they've been accepting referrals from the court for people on probation for 20 years. and the court would order treatment to, like, well, this individual has to complete 16 weeks of group or has to complete 30 days of programming or whatever the court order would involve. And the agency then would find itself saying, or the program would saying, well, Rick didn't complete 30 days or 16 weeks or whatever he was ordered to, but that's because he's in the preparation stage of change. And so we're satisfied that he's making good progress relative to his stage. Meanwhile, some probation officer or some judge, I mean, what the hell are we talking about? Stages of change and preparation stage, whatever. Did he do what he was asked or required to do, or didn't he? Well, if you're going to make changes to your programming that have historical relationships with the community, be it community housing or the court system or whatever other stakeholders external to the program that touch the same clientele that you do, we've got to be proactive in engaging their input, their buy-in, their participation, as Sarah described, up front, not finding ourselves 7 months into a project and then the court comes and says, what are you doing here? This is not what we thought we were referring to. Those kinds of relationships need to be fortified on the front end.
I agree.
Onward. We ask very frequently about what is the staff engagement and retention dynamic in the organization. Now, we all know coming out of the pandemic that things just got weird. And there are pockets of our state that are still trying to get out from under some of that. We know that we have a workforce shortage. We know that workforce development issues are pervasive, not just in Ohio, but around the country. So we need to understand what the turnover in an organization looks like. And we'll get asked at times, well, why do you need to know that? Well, it's important to know if there's a reason, like if we have 75% turnover in XYZ program, and it all seems to be related to whoever's running XYZ program, then we should talk about what else you plan to install into that program if you don't have the right leadership in there, or what the TA considerations are. This is something we've talked about here for 20 some years. If an organization's typical turnover is 25-30% per year, which is not unusual, by the way, within 3 to 4 years, an agency has completely turned over its staff. So you lose, like, oh, well, we did that training 3 years ago. We did that skills practice session 3 years ago. I hate to tell you this, but all the people who were here for that aren't here anymore. So what provisions do you have for ongoing supervision, for ongoing TA, for ongoing whatever you need, knowing what the turnover rate is for your organization? Now, the good news is there are organizations we encounter that have very limited turnover. And when they do, they talk about it as very organic promotions or people who just moved out of the community or things like that. Not people who are leaving an organization in droves every 6 months for some mystery reason. So there are places out there that do manage to retain and do a really nice job with staff engagement. But understanding what that dynamic is should inform our planfulness about what we're proposing. If we're thinking we want to be from, Sarah's brought up multiple times, sustainability, if we want this program to continue in perpetuity, then we have to have provisions built in for how are we going to keep all of our new staff continually onboarded to whatever programming knowledge, skills, etc., that they may need. Yeah. Sarah, any other thoughts on that one?
Yeah, we've seen a lot as it relates to staff retention specifically. Certainly echo the sentiments around the workforce challenges, and many projects did have had delayed start times due to hiring challenges. And I think something to be honest about is if you're if in a region, all the grantees are wanting to hire a bunch of peer supports, but we know we don't have that many peer supports in that region. Like, where are they coming from? And people, we end up kind of stealing from each other. So I think just, again, reflecting and being honest about like, what's the likelihood of like finding this person? And some grants, it's, they were looking for a unicorn, like, are we going to find that? How quickly will we find that? But we certainly understand this challenge. But I think just kind of knowing what the landscape looks like in your community before applying for a funds, especially if it includes like hiring new staff that, are specialized. And then also we've seen that staff turnover impacts the program implementation and grants management. So my advice here would be have more than one person be involved in the grants management so that if the person that was supposed to do your reporting is no longer with you, there was a backup person. So that the work can continue and more than one person is kind of the keeper of all of this information. Again, broken record about have that internal team involved from the RFP discussion, the application, the grant agreement, and the reporting so that you have kind of this institutional knowledge about the grant so that you can be successful, not only implementing it, but managing it and reporting on it. And then, is there anything you can do before the official start date of the grant so that you can be ready to rock and roll when it starts? And if you're a part of a larger bureaucracy and you're wanting to post a position, like, is there anything you could do in advance to be ready? Or just some things, that we've seen that could potentially help eliminate some of these delays and hiring challenges. But we get that this is real, and are certainly understanding of it.
But there's one last implication in here too that comes to mind is some of the projects that we're implementing or that we're seeing implemented have a philosophical orientation attached to them or a particular perspective that one needs to bring to be successful in that work. And ensuring that when and if there is turnover or whatnot, if you built a program, and I'm not endorsing anything here, I'm just using an example. If you built a program that's centered around a philosophy of abstinence only, then bringing in somebody to replace that person who has a harm reduction only approach is not going to be compatible with what you're doing. So ensuring that when there is turnover, particularly in leadership, is where we see this most often. Well, the new clinical director doesn't see it that way. The new program manager hasn't done it that way in the past. Where if we're thinking about bringing people into projects, that we're being thoughtful about, does this person bring the right philosophical orientation to the project the way that we want to see it implemented, and that we're not bringing in somebody who might be incompatible with either the framework or the guidelines, the fidelity scale, whatever it may be. Champions. We have a saying around our center, if it isn't somebody's job to do it, it's not going to get done. We'll have all kinds of great ideas. Great ideas abound. I'm surrounded by some of the best idea people you go. But if we don't move something to, okay, who is going to lead that or who is driving that bus, then it can stay a good idea for a very long time. And this dynamic or phenomenon of having an identified initiative champion, who is the person that really wants this in the organization, who is willing to get out in front of it, sometimes needs to be a cheerleader, maybe internal to the organization, maybe external to the community, maybe both, but someone who is willing to own the identity of the initiative and champion it in anywhere it's called for. And it's interesting to see the difference in this dynamic when somebody is named the champion versus when somebody organically expresses but their own buy-in, and you can see that buy-in exhibited in their enthusiasm and the way they conceptualize the project, where they energize for the project. And it has a lot to do. So we'll ask people, who do you envision as the champion? But oftentimes, by the time we get to this question, if somebody has already been the loudest voice in the room speaking about what's going to happen, we might kind of know who the champion is. Nonetheless, it's a question that's very worthy of a leadership group or an implementation group to say, all right, and who's going to be the point person on this, whose job it is to go meet with stakeholders, to go do community presentations, to do in-house staff training, to make sure that all of the internal work team are talking to each other and getting what they need done, who will be maybe the point person to communicate with the foundation. That somebody who's got a very distinct leadership role is identified, and optimally or ideally, because they're championing something they're personally passionate about versus something that they've now been assigned. We saw a situation once where a person was told, you need to become the champion of this initiative or else, because your other job is being eliminated and it's your only job that's available to you. Well, I'm here to tell you that while they took the new job, their energy and enthusiasm and passion for that role were not quite what they would be if it were them doing work that they had signed on for and their previous position had been eliminated that way. So there can be a very significant difference between whether or not a champion is fully bought in or not based on whether they've been assigned to that role or whether they've self-selected into that role.
Great point.
Identified practice models. We've begun doing this now. CCBHC's really sealed the deal for us. If you're signing on to deliver a service that requires a multiple component framework, there are 10 aspects of this program. There are 26 items in this fidelity scale. There are 35 elements of guidance in this evaluation tool. Are those in leadership familiar with the elements of what it is they're implementing? We've started giving people, when somebody says we want to do this evidence-based practice model, we give them the fidelity scale up front and say, go through and read every obligation that the team would be expected to fulfill and identify any that don't sound doable to you. Because we might have to have a conversation about whether this is a doable aspiration or not based on what it is that you feel you can or can't do. Now, it's one thing for somebody to say, well, this isn't a deal breaker, but we don't have any staff that know anything about this topic. Well, that's a knowledge transfer thing. We can help people learn stuff, right? That's not a deal breaker. But here's one that was a deal breaker. We want to implement assertive community treatment across a 6-county area. Well, the model requires a dedicated full-time physician for that. And when we pointed that out, they said, we can't even get a dedicated full-time physician for our 6 counties, let alone for one team serving 50 to 100 people. All right, well, that might be a deal breaker for some folks, right? Where required elements of a model, specifically ones that have fidelity scales, are not within the doability circle of a given organization. So it's kind of, I guess, to summarize this one, there's some informed consent that goes into here's the actual framework. So you want to do a CCBHC, so you want to do IDDT, so you want to do whatever. Here are all of the things that are required of an organization to satisfy the health authority, to satisfy the funder. Let's talk through all of these things first so that you know and we know what's all involved. And you don't find yourself receiving the funds, being tasked with timelines, then looking at the tasks themselves and going, oh, well, we didn't know we were going to have to. And there's always unanticipated stuff. I get it. But I'm talking about organizations that didn't know what the staffing requirements were going to be, or didn't understand how much training was going to be involved, or any of these kinds of things. So that we strongly encourage proactive discussion with whether it's a TA provider or an evaluation team and a health authority, a funder, there's some discussion about what the expectations are up front, and that nobody is finding themselves halfway through an initiative figuring out that they can't do what they signed on for.
Yeah, that's, when I think about kind of what the foundation has seen and learned, and all of this will be in the RFP when it goes live in December, but, we make folks attest to being appropriately licensed, certified, or accredited for whatever it is that they are proposing to do, because I know that, again, not all of the things we fund have, very specific curriculums to follow and fidelity measures and things like that. But, if you're going to open up a recovery house, are you going through the process of becoming, getting on the registry and certified? If you are planning to start, you name it, anything in these abatement strategies, are you following kind of the best practices? Are you plugged into the associations where you can get training and education on kind of what is the latest and greatest, so that we're following kind of these models that we know to work, because all of our projects at the foundation have to be supported by evidence. And so one of the things that and we'll be doing more to help applicants with this, but making sure you know the research that supports what it is you're proposing to do, not just the rationale for why said program, service, project, curriculum is needed, but what is the evidence that supports using that specific thing or doing that specific thing for the population you're planning to serve? And you're going to need to be able to articulate it, because again, all of our projects have to be supported by evidence, and we'll be doing more to help applicants kind of gear up for that. But that came to mind when I thought about, identified practice models. And if you are implementing one of these more clinical models, do you know the full cost of implementing it? Because when we then look at your application and the budget, if we don't see kind of a plan for all those costs, maybe we're not funding the whole thing. But if we don't see a detail, that kind of makes us wonder, are you really implementing this to fidelity? Because we know that when we don't implement things to fidelity, it can actually cause harm. So it's really important that we kind of know these practice models and the research around what we're trying to do to make sure that we're implementing them in the right way. And to that point, making sure you do have a plan for how you're going to monitor what you're implementing, what training is required, and then the supervision. Again, these things kind of all weave together for me, because we want to make sure that it's being implemented to fidelity. Again, whether it's some clinical thing or a prevention curriculum that has, these validated measures or not. Everything that we fund, everything that we do, kind of there is some research and best practice around them. And we want to be following that and having a plan for knowing if we're doing it, so that we can get it back on course if we need to. So that's what we've seen.
One other quick point on that last slide, Sarah. And we don't have time to get into all the details of it today, but it's something maybe you and I can circle around for an FAQs or something like that for fidelity and potential future applicants. Not every fidelity scale is in the public domain. Mm-hmm. Not every evidence-informed practice has a fidelity scale. There are academics who did the research because they wanted to see if something worked or not, but they didn't take it so far as to, here are the ingredients that translate into real world practice implementation. So it's one thing to talk about fidelity as if there's a readily accessible, publicly available tool with really clear guidance. We were spoiled for years because SAMHSA endorsed a number of treatment models where their requirement for the support of those models was for the fidelity scales to be put in the public domain. And many frameworks and models are very much that. But there are a few very popular ones where the people who own the proprietary rights to that framework require you to pay them both for their training and consultation as well as evaluation to their scale. One in particular we reached out to, and we wanted to do fidelity to their scale, and they flat out told us, no, we're not outsourcing that at all. It's us or nobody. Okay.
Good thing to keep
All
in
right.
mind.
Yeah. Lessons learned. This is a critical question that I make sure I almost always wrap up readiness with. And it's born from being an outsider to an organization when we're a consultant. That is, I'm coming into this project as a consultant, and I have no context for your organization's lessons learned. You've clearly implemented other things than this. Some of them may have gone fabulously, others may have gone horrendously. You know more about what has worked in your organization and what has not than we do. The question that we pose is, what are those lessons learned? Like, I'll ask very specifically, what do you consider to be the most successful thing that you've ever installed in your organization? Tell me what the ingredients of that installation were. Oh, well, we did bottom up and we did lots of routine communication. We made a lot of on site TA available. We did this, we did this. We met on project planning every other week, going, all right, look, those ingredients, those lessons learned apply to whatever it is you're implementing. Doesn't matter the model, doesn't matter the framework. These are organizational dynamics and community dynamics where we know that every time we've worked collaboratively with law enforcement, it's gone better than it has when we went rogue. All right. Well, we know that we want to collaborate with law enforcement if that's a success ingredient for us historically. So we ask an organizations to really think on, reflect on what have been their own lessons learned about what has contributed to success, what has been less than successful. And I will flat out ask them, write out your recipe for me because it's going to inform our implementation plan. If you know that when you do X, Y, and Z, you've seen nothing but good results, then we want to make sure we apply X, Y, Z to this initiative. And again, that's not something I'm bringing in from the outside. I can bring in content expertise on a given model or a given framework, but process expertise, like what works best with your staff constellation, with your leadership team, in your community, going to be subject to a lot of unique variables that aren't contained within the content of the framework that we're talking about. So, really important to be dialed into what are our own organizational lessons learned about what's worked and what hasn't for us.
Great points. And we've got some lessons learned. And again, this probably is not a surprise. I've said them before, but they're worth repeating. Think of these as kind of, the golden rules that we've seen in our, best practices for any grant. Your fiscal, program, data collection staff need to, as a team, step 1, read the RFP. Do we all have a clear understanding of what's going to be involved? Are we eligible? And is this a good fit? Because y'all know it takes time and resources and energy to apply for funding. And so we want to make sure that this is a good fit for you. So all those key folks be a part of that reading of the RFP. Should you get funded, those same people need to come together to read the grant agreement. This is a very important legal document, and everyone needs to be on the same page about what is expected. So have all of them read that so that everyone knows the requirements. Because there could be things that come up where you realize, ooh, we're going to need to report on that, but we don't track that. Or we don't do things in such a way that will allow for us to report on this. Know that on the front end. And then walk back through your application with that same group of people. Remind yourselves of what it is that you said that you were going to do. And if you received a partial award, what adjustments do you need to make? Because we don't want folks waiting until the very last minute to request any changes. We want to know all of that on the front end so that everyone is set up for success. And then kind of lastly, the fourth step here would be to have monthly implementation meetings. to check in with one another. Where are we with numbers? Where are we with spending down of the grant funds? Is there a report due that we need to be preparing for? So this is what we've seen our grantees that, these are kind of best practices that are emerging among those that kind of have all these key internal people aligned. And if you have a separate grant writer, whether they're outsourced or someone internal, they need to be a part of these conversations as well. So that, they write for a grant that, checks all the things we've been discussing this whole morning. So that this is a good fit for everyone. So I know those have been some of our lessons learned, and I wanted to, as we look to wrapping up. Oh, Rick, did you have something?
One quick point
Yeah.
on number 4, Sarah.
Yeah.
That your lesson learned there, the monthly implementation meeting, shows up over and over in implementation science under the name process monitoring, which is not just are we monitoring the outcomes or the impact, but we're monitoring the implementation process. And we've seen some organizations who they maybe toggle that. They do weekly implementation meetings for the first 3 months and then move it out to monthly or then out to quarterly or something like that. But where there is a recognition of a need for a project plan, of a fidelity action plan, what do we need to do to get in adherence with what's in fidelity, and what mechanism by which are we reviewing those things with that group that you talked about, making sure everybody remains same paged. You heard me say before that supervision probably makes or breaks things more than anything else. Process monitoring is a very close number 2 in terms of critical elements of ongoing success. I was glad to see it show up there for you.
Oh, good. That's great to hear. Well, kind of lastly, some common traits of what I would call our implementation ready grantees. They obtained all of that stakeholder key partner buy-in prior to submission. And Rick mentioned this earlier, they began with the end in mind. Think about, what's, sustainability, thinking about what are the things we're going to need to track and report on. And is that built into then what we are doing? Think about the end, not just kind of, ooh, excitement, grant, apply. Think about the end and what that ultimately means and how it's going to be implemented and then sustained, which leads us to having a comprehensive sustainability plan. They did the PSAT and started to tackle some of those elements. They leveraged this funds for other funds. They really have a strong game plan for how they were going to continue this work. Also had a plan for hiring staff. And were very clear, knew what they wanted to do. They read and understood the details of the grant agreement. So our implementation ready grantees knew what they applied for, knew what they got funded to do, knew the grant agreement. And then lastly, they have had that internal alignment with all the key staff. And so these are kind of some common traits we observed in our implementation ready grantees. And we hope that this is helpful to you as you think about grants that you are applying for, because we want everybody to be implementation ready. We want everyone to be successful in their grant writing, whether to apply for funds to us or to any other funder or foundation that you work with. So if you missed it earlier, this is the QR code to be able to pull up the implementation readiness checklist that Rick has so graciously walked us through today. We will link to this on our website. We will be posting the recording of today's webinar along with the slides so you can refer back to it. And there have been some previous Impact Academies that you may want to check out. Back in April, we did one on sustainability that I mentioned. So you can watch that presentation. That was on the PSAT tool, that free program sustainability assessment tool. And then in January, we had done a grant writing workshop. So definitely check that one out as well as you start to gear up to apply for a grant, to learn kind of some of what we saw in successful grant applicants. And then we had a guest speaker walk through grant writing best practices and where to find other funding I know there's a lot changing, but there are still a lot of opportunities out there. So definitely check these out. I know a lot of you had questions about, kind of office hours and additional trainings, webinars as we get closer to the RFP going live. We will be having a lot more training geared towards potential grant applicants, including one where we go through the RFP and all that it entails. We're going to launch a new evidence guide to help you with meeting the evidence requirements of our funding. So we'll have a whole Impact Academy on that. Our expert panel may do something special with all of you. Stay tuned. And then we'll have lots of opportunities to answer questions. So we're really excited about what's to come. Be checking the grants headquarters page. That is where we will be putting all of those resources, and stay connected with us. We really hope that what we've done today, going over this checklist, sparked some ideas of where to maybe focus some of your time and energy right now to gear up. And we want to help you continue to build your readiness and be successful. And so stay connected. More is going to be coming. Follow us, email us, info@oneohiofoundation.com. If you have any questions, we'll be happy to share resources with you. I think we have a couple minutes left for questions. Mackenzie, if there's anything you want to bring up with our 2 minutes left. And we will email us if we don't get your question, or if we haven't already, we'll definitely send you a response back.
Now, I'll owe you a copy of the Fix and monograph on implementation. As well, it's worth noting that at the back of the readiness checklist is an absolute pile of references and resources for implementation science. Made sure to include just about everything we know that we incorporate, and I think you would find it very helpful. So be sure to grab a copy of that. Again, free download, free to send out to you if you want the physical copy. Not trying to gouge anybody here. Want to make sure the information is in your hands and useful to you.
Because the webinar was really focused on preparation, one of the questions we had was from someone that said that their organization was getting ready to go into strategic planning in 2026, and they asked if that should influence whether they try to apply now or need to maybe wait until after that strategic planning process has taken place.
That's a good question. Rick, I'll let you go first.
You could look at it from a couple of different ways, where if it goes back to the question at the beginning of readiness and the why now. You should know why you want to do this before you go in. Well, let's just ask for money and then see if it fits into our strategic plan. I think more often than not, I would coach to say, lay out the priorities in your strategic plan and then determine if this is a fit. And how you advance and start there. It could be a theme that is going to carry over from years of work in that community, is going to factor into an ongoing strategic plan, wherein you don't have to wait to introduce it because everybody knows it's going to be in the mix. So I think there are some nuances and variables. It's not going to be an all one size fits all. But generally speaking, having the priorities that emerge from a strategic plan well established before we embark on a direction that may not align perfectly or very well with that strategic plan is probably worth exploring on the front end, rather than finding yourself in year 2 of the strategic plan saying, this has nothing to do with where we actually thought we needed to go.
I think that's a great response. Yeah, I know many of us are involved in strategic planning. So it's great to make sure that all these things align, that we're going after funding for the things that are in our strategic plan. So I know that's true from some of the nonprofit volunteer work that I do. So, well, we are at our time. We so appreciate all of you joining us today. I learned so much. Thank you, Rick. This was so great. I hope this was helpful to all of you that joined us today. And send us your questions if you have any. We'll love to answer them. Again, we'll post this recording, the slides, the link to the checklist, and stay tuned. We're going to have a lot more coming. So again, thank you all so much. Enjoy the rest of your day.